Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kinder Medical Center in Singapore. Welcome to the second video of our Diabetes Health and Prevention video series. We hope you enjoy it. The title is Type 2 Diabetes in a Nutshell. The purpose of this video series is to promote health in diabetic patients and patients at risk through patient education so they become more aware and conscious about type 2 diabetes mellitus, other metabolic disorders, and other complications, to aid people to take care by themselves better, understanding their body and their disease in a better way. But this video series does not replace going to the doctor for diagnosis, treatment, or prognosis. Let's start with the burden of diabetes. In Singapore, diabetes is, after heart attacks, heart problems, the second most common cause of ill health and death. Around 500,000 Singaporeans, that is 1 in 9, have diabetes. 1 of 3 of them, they don't know it. 1 have a very poor diabetic control. Half of the heart attacks in Singapore are caused by diabetes. 2/3 of the kidney failure in Singapore is caused by diabetes. And also an important number of strokes are caused by diabetes. And where it is worst, by 2050, 1 million of Singaporeans are expected to have diabetes. So we need to do something now to try to defeat this outlook. Let's talk a little bit about sugar physiology. After you eat, the blood sugar goes high in the blood. That stimulates the production of a hormone called insulin that is like a key lock to open the gates inside the cells. So like the sugar goes in, where the sugar is a fuel for all the work processes of the cells. In diabetes, there is a dysfunction of those mechanisms. There is 2 types of diabetes, type 1 and type 2. In type 1, there is a destruction of the cells that produce insulin, so there is no insulin production. So the sugar levels raise in the blood with consequent damage to many organs, and the cells are sort of starved. In type 2 diabetes, there might be a deficiency in the production of insulin or an excess on insulin production because there is resistance to the functions of the insulin. So there is also an excess of sugar in the blood that cannot enter into the cells. What causes diabetes? There is family predisposition, sometimes some medications, but typically an unhealthy diet, high in sugar, overweight, lack of exercise has been associated with diabetes and are important causes of diabetes. The important thing of that is that those can be modifiable. So what are the symptoms of diabetes? Patients can feel tired, go to the loo to urinate very frequently, very hungry, they can lose weight, feeling very thirsty, and in the long run, they can have symptoms, in bed, with sexual dysfunction. Women are predisposed to vaginal infections. Also, there can be poor healing of wounds, tingling of pain of hands and feet, or vision problems. And if diabetes, especially not well controlled, there could be worse complications. There could be damage to several organs, including the eyes, with poor vision or even blindness. The heart with heart attacks, and potentially death. The brain with strokes, the kidneys with kidney failure, the circulation of the legs with poor wound healing, infections, and maybe amputations. something that you would like to avoid. So how diabetes is diagnosed and what is pre-diabetes? Diabetes is diagnosed by measuring high levels of blood sugar. You can do it at fasting or after receiving a liquid dose of sugar and see how high your sugar in the blood goes. Sometimes some patients that have symptoms typical of diabetes can just measure the sugar randomly, meaning not during fasting, and if it's at a certain level you can also diagnose diabetes. But there is another test called HbA1c or A1c. It's a derivative of hemoglobin, that is the protein that carries oxygen in the blood. When there is high levels of sugar in the blood, this hemoglobin gets caramelized, and by measuring the levels of caramelized hemoglobin over normal hemoglobin, you can detect if the patient has had good control of sugar in the last 2 to 3 months, and in that way you can also diagnose diabetes. Prediabetes is a stage between normality and diabetes. The blood sugar is not so high, but still there can be damage going on, and these patients can also have high risk for heart attacks. The important thing is that can be preventable from normal to prediabetes if you do some changes now, or you can prevent also the moving to diabetes with some changes also in your lifestyle. So how diabetes is managed? Every patient with diabetes should have a healthier diet, to exercise if possible, if the heart allows, and should consult doctors and other specialists. Sometimes these measures are enough for some patients. They don't need to take medications. But when this is not enough, the patient needs to take medications and even insulin. So, can you change your outlook? I trust you can, and I trust many patients can. And we have adopted this slogan of become a healthier version of your previous self. That implies what I just said. But you just need to do a little bit more, because you want to avoid all these complications I already mentioned, to live a healthier, longer, and fuller life, to continue enjoying life in the way you desire and dream with your loved ones and friends. And we can also offer extra help to make it simpler, more effective, and more sustainable. What are our strategies? Singapore has declared a war on diabetes in 5 battlefronts: prevention, with better lifestyle and diet, screening for timely detection, try to control the sugar in patients with diabetes in a better way, educate patients or the population about diabetes, and try to preach the importance of all this. We are also declaring the war against diabetes, and we will be relentless. We are in fact involved on all those battlefronts. Our center is involved in all those battlefronts, either by the service we provide in our center, by our YouTube channel, what you are actually seeing now and you will see, our Facebook posts, and by the coming health and prevention program with the aim to prevent prediabetes, prevent diabetes, or make the life of diabetic patients more bearable with less complications. So I hope you enjoyed this video. Please stay tuned, subscribe to our YouTube channel, call us for information. The next video is part 3, type 2 diabetes in-depth information. So for some patients or some people that would like to know more details about diabetes, that will be the next video. A little bit longer, not so many pictures, but useful information. for those that want to know more, to be able to control their disease better, to be on top of the disease. So take care. Bye bye.